A new year, new round of medical questions for a doctor that's pretty familiar to us. Dr. Amy Cobb joining us now for Doc Talk from University Health. Happy New Year. Thanks for being here.
Happy New Year.
So, New Year, a lot of people make New Year's resolutions, so many things focused on health. So first question for you is, what is the science around forming and keeping a new health habit?
Yeah, so the first one I would say is it needs to be specific. I ask patients all the time, what are your health goals right now? And they go, lose weight. I say, ask them how, and they say, eat better, right? But we need to be more specific. So an example of a good goal might be, I'm going to cook one new recipe every week, or I'm not going to eat out more than once a week. Or for exercise, I'm going to do 20 minutes of strength building twice a week. Because that brings me to the next tip, which is to track it, right? If we don't have a measurable goal, how are you going to know whether you're achieving it? And so this can be as simple as a calendar where you just give yourself a check. There are all kinds of app trackers you can get on your phone. You can even use something like a Google spreadsheet and share it with friends, which brings me to number 3, which is accountability. This is actually the number 1 predictor of if you'll keep a good habit, is if you have accountability. And you can make it even more interesting by linking it with like a promise and a consequence. So an example of this might be, this is actually a real one I did one time, is I wanted to get more sleep, and so I set a bedtime, and I said, if I don't make it to bed by my bedtime, then I'm going to donate $10 to dementia research, because I know I'm going to need that research later on, so I'm not resting, right? So you can gamify it and make it fun. That's really fun for accountability partners as well. Another fun one, this isn't health related, but I wanted to declutter my home. And so I said, if I didn't donate one thing or get rid of one thing in my house every week, I'd take a picture of the most cluttered part of my house and show it to my mother-in-law. And you better believe, like I did it, right?
Yeah.
And so you can have a lot of fun with this. And then my last tip would be, I want people to really reflect on how they feel after they do the habit, right? Like most of us don't want to work out before we do, but afterwards we feel amazing.
Right.
And so that's how we build on our habits, is if we take that moment to reflect and like, how has this impacted me? How do I feel now?
I like the mother-in-law accountability.
Yeah, there you go.
I have to work that in there. All right. So we know that exercise is great for fighting aging and dementia, like you said.
Right.
What is the science around basically what are the best exercises to combat aging?
Yeah, so the number 1 is actually strength building exercises or power exercises, which I was surprised when I heard this for the first time. And the thing I think you should know is that there's something called sarcopenia. We talk about osteopenia, which is loss of bone strength, but we also lose muscle mass starting in our mid-30s at a rate of 1 to 2% a year. And then that accelerates to about 3% a year when we're in our 60s and 70s. And so by doing that strength training, we're doing a few things. One is when we have more muscle mass, we burn more calories, which helps us maintain our healthy weight. But the other thing is if we have power in our muscles and we miss a step on the sidewalk, we can rebalance ourselves, prevent falls. It just has so many impacts on our insulin sensitivity, preventing diabetes, keeping our joints moving, all of those things.
Yeah.
The second one we've mentioned on this segment a few times, which is cardiovascular exercise. I think Dr. Lopez and I both have mentioned the 150 minutes of moderate intensity physical activity, per week. You can shorten that to 75 minutes per week if you're doing high intensity exercise. So a quick check for this would be, if you're able to sing, it's low intensity. If you're able to talk, it's moderate. And if you have trouble talking, you're kind of breathless, that's probably high intensity. But there's actually 2 other kinds of exercise for aging that I would call out. One is flexibility training, and you can work that into the end of your strength or your cardio, just a few minutes at the end to strengthen and lengthen those, or to stretch and lengthen those muscles. And then stability work for aging about twice a week. So this would be work on one leg where you're really working your core. Your thighs, your buttocks, all that area. That's again going to help you with falls, because falling is, can have a lot of ramifications as we get older.
Yeah, mobility is so important.
Yeah, absolutely. Yeah. Okay, another question that's timely right now. What should people know about the discontinuation of the brand name Flovent inhaler?
Yeah, so Flovent inhaler is commonly used for chronic lung diseases. We think about COPD, and we use it a lot for asthma as well. And it actually went off the market on January 1st. And so it's bad timing for a lot of patients because this is flu, RSV, and COVID season, as we've been discussing. And this is a time when people's chronic lung diseases can be flaring. So it's very important that if you are on Flovent, that you talk to your doctor to figure out what you can switch to. There is a generic version made by the same company, but it's not covered by all the insurances, so you might actually have to switch to a different medication.
Oh, wow. Okay, so something to keep in mind if you have to talk to your doctor, have those conversations.
Right.
All right. Viewer question now. How common is hypolordosis and what are some symptoms as well as treatments for it? First off, what is hypolordosis and am I saying it right?
You said it beautifully.
Okay, good.
So the back, if you look at it from the side, should have like a gentle S-shaped curve, okay? Because there's 3 parts. It's the cervical, thoracic, and then lumbar spine. So hypo, this is a Greek suffix. It means under, lordos means curvature, and then osis means disease. So it's like a lack of curvature in your spine or like a very straight back. I don't have a good number for the prevalence of how often this comes up, but we probably would underdiagnose it anyway because it's not commonly screened for. But the symptoms would be pain and fatigue in your back, maybe feeling like you're kind of hunched forward, feeling off balance. And the main things are going to be exercises, physical therapy, stretching. For the muscle fatigue, you could also consider massage, heat, or seeing a practitioner such as an OMM, which is osteopathic manipulative medicine doctor, who maybe could do some manipulations to try and relieve some pain.
Okay. Next question from a viewer. This one is about a vaccine. This viewer writes, I am compromised without a spleen. Do I need to get a booster meningitis vaccine?
Yeah, the short answer is yes. So the spleen is very important to fight types of bacteria called encapsulated bacteria, which are ones who have this extra protective layer around them. And some examples would be Neisseria meningitidis, which causes meningitis, but also Streptococcus pneumoniae, Haemophilus influenza type B. And so what the spleen does is it creates these special cells. They're called phagocytes, and they're like Pac-Man that go and like eat these encapsulated bacteria. And without it, you're at risk of very severe infections. So if you don't have a functioning spleen, either because you were in an accident and the spleen started to bleed and they had to remove it, or maybe you have a medical condition where your spleen's in your body but it doesn't work. That would be like sickle cell anemia or HIV. You want to get the pneumonia vaccine and the HIB, the Haemophilus influenza type B vaccine, like as soon as you're diagnosed with a spleen problem. And then you have to get your meningitis series with boosters every few years. It gets confusing because there's 3 different meningitis vaccines, but there are regular boosters. They're about every 2 to 3 years for one type of vaccine, every 5 for another.
Yeah, wanted to remind everybody out there, it's our segment, but we want your questions. Here's our QR code we're going to put on the screen right now. If you have a question for our doctors, we're going to ask them. Just give it to us. Just scan this QR code to submit your questions to us right here at KSAT.
Every Thursday right here at 6:30. Dr. Cobb, thanks so much for being here.
It's my pleasure. Thank you.
Good to see
We'll
you.
see you next time.
Good to see you.
We'll be right back.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.